Urologist explains how bicarbonate improves blood flow in aging men. Naturally, as men gracefully transition through the years, a familiar narrative often emerges: the subtle yet undeniable shift in bodily functions. Energy levels might feel less robust, stamina can wane, the recuperation period following exertion lengthens, and the sense of vigorous circulation seems to diminish. It's a common observation, one that many men accept as an inevitable consequence of aging. However, what often goes unrecognized is that these changes extend beyond mere chronological aging. There's a deeper, more intricate process unfolding at the very fabric of our cells, a silent architect that shapes blood flow, physical performance, and the overall vitality of men as they mature. Today, we are going to delve into a subject that, surprisingly, receives very little attention, yet possesses a remarkable capacity to influence these aspects of health. This powerful yet deceptively simple element is bicarbonate. Yes, the same bicarbonate that is commonly linked to baking soda, a household staple. Yet, when we truly understand its profound role within the human body, particularly for aging men, it has the potential to fundamentally alter our perception of blood circulation, energy reserves, and the pursuit of enduring health. Please remain with me, because by the conclusion of this discussion, your understanding of how blood circulates within your body will be illuminated in an entirely new light. For those of you who are joining us for the first time, my name is Dr. Sarah, and here on this platform, we engage in frank, scientifically grounded conversations about health, fitness, and the intricate workings of the human body as we navigate the aging process. My intention today is to communicate with you as I would with a patient sitting across from me in my clinical office, dispensing with any sensationalism or marketing ploys, and instead offering clear explanations grounded in physiology, practical applications, and unambiguous clarity. One of the most prevalent concerns I encounter in my practice among aging men is the gradual reduction in blood flow. This decline manifests itself in a multitude of ways, affecting various aspects of daily life. You might notice extremities that feel perpetually cold, a diminished capacity for sustained endurance during physical activities, a prolonged recovery time after workouts, or a sense of mental fogginess that wasn't there before. And of course, it can also present as alterations in sexual performance and changes in urinary health. Blood flow, in essence, is the very conduit of life. Every single cell within your body is critically dependent on it. The delivery of vital oxygen, the transport of essential nutrients, the nuanced signaling of hormones, and the efficient removal of metabolic waste products. All of these fundamental processes hinge upon a well-functioning circulatory system. Consequently, when blood flow begins to falter, every system that relies upon it starts to experience its repercussions. Now, here's a crucial point that many men are not fully aware of. The concept of reduced blood flow is not solely attributable to issues with the heart or the unfortunate reality of clogged arteries, though these are indeed significant factors. While they form a part of the larger picture, they do not represent the entirety of the narrative. Blood flow is also profoundly influenced by a delicate equilibrium known as pH balance, or more formally, acid-base regulation. This encompasses the body's ability to maintain a stable internal environment and the responsiveness of our blood vessels to dilate effectively in response to the body's demands. This is precisely where bicarbonate emerges as a central player in our discussion. Bicarbonate stands as one of the most vital buffering systems that our bodies possess. It is a compound that our bodies generate naturally, and it plays an absolutely critical role in maintaining the precise pH level of our blood. It's important to understand that our blood must remain within a very narrow pH spectrum. If the blood becomes even slightly too acidic or too alkaline, the optimal functioning of our cells is severely compromised. As the body's internal environment leans towards a more acidic state, a condition that becomes more prevalent as we age, our blood vessels exhibit a diminished degree of flexibility. They lose their capacity to dilate as readily, meaning they struggle to widen to accommodate increased blood flow. This directly impacts the efficiency of oxygen delivery to our tissues and consequently blood flow begins to suffer. Several interconnected factors contribute to this subtle but significant shift towards a more acidic internal environment in aging men. The natural decline in muscle mass, for instance, reduces the body's inherent metabolic buffering capacity. The kidneys, which are essential for regulating acid excretion, undergo gradual changes in their function, leading to a less efficient acid removal process. Dietary patterns often become less supportive, with an increased consumption of inflammatory processed foods and a reduced intake of essential minerals. Furthermore, persistent high levels of stress and a decline in the quality of sleep can exacerbate this tendency towards acidity. All of these cumulative effects contribute to what we term an increased metabolic acid load. When acids begin to accumulate in the bloodstream and within the tissues, the body is compelled to neutralize them. Bicarbonate serves as one of the primary tools at its disposal to accomplish this task. However, here lies the crux of the matter. As men age, both the availability of bicarbonate and the efficiency of its buffering action can gradually diminish. This means that acids are not cleared from the system as effectively, lingering for longer periods, especially during periods of physical exertion or stress. And this acidic internal environment has a direct and detrimental impact on blood flow. Let me elaborate on the precise mechanism. At a fundamental level, our blood vessels are lined with a delicate layer of specialized cells known as the endothelium. This endothelial lining is responsible for orchestrating the signaling process that dictates when a blood vessel should dilate, thereby allowing for an increased flow of blood. One of the pivotal molecules involved in this crucial signaling pathway is nitric oxide. Nitric oxide acts as a powerful signal, instructing blood vessels to relax. It is absolutely indispensable for maintaining healthy circulation, particularly to areas such as our muscles, our brain, and the vital pelvic region. The critical connection here is that acidic conditions actively undermine the availability of nitric oxide. When the blood becomes more acidic, nitric oxide tends to degrade more rapidly, and consequently, blood vessels lose their ability to achieve full relaxation. This leads to a state of increased vascular constriction, reduced blood flow, and over time can contribute to elevated blood pressure. Bicarbonate intervenes in this cascade by buffering excess acid, thereby helping to restore a more neutral pH balance and safeguard the integrity of nitric oxide signaling. This is precisely why bicarbonate has been the subject of extensive research within the field of sports medicine. For decades, athletes have utilized bicarbonate supplementation as a strategy to enhance endurance and delay the onset of fatigue. Yet, what is frequently overlooked is the profound relevance of these findings for aging men, even those who do not consider themselves elite athletes. Everyday activities, such as walking, ascending stairs, engaging in strength training, or even the physiological demands of sexual activity, all rely on rapid blood flow and the efficient delivery of oxygen. When the body's bicarbonate buffering capacity is compromised, these activities can feel significantly more demanding than they ought to be. Let us now turn our attention specifically to the unique challenges faced by aging men concerning blood flow to critical areas like the pelvis and the urinary system. Robust blood flow to the pelvic region is not merely important, it is absolutely essential for maintaining prostate health, ensuring optimal bladder function, and supporting healthy sexual performance. A reduction in circulation to this area is intrinsically linked to the onset of urinary symptoms, difficulties with achieving or maintaining an erection, and a decrease in sensory perception. While pharmaceutical interventions do exist to address some of these issues, they often fail to address the underlying metabolic environment that is contributing to the problem. By bolstering bicarbonate buffering and promoting a healthier internal pH balance, the blood vessels within the pelvic region are better equipped to respond effectively to the body's needs. This is not to suggest that bicarbonate is a panacea or a miraculous cure. Rather, it signifies that it plays a supportive role in one of the fundamental physiological mechanisms required for proper function. It facilitates blood vessels that are capable of relaxing appropriately, thereby enabling the delivery of more oxygen, more nutrients, and more vital hormonal signals to the tissues that require them. Another crucial aspect to consider is the impact of bicarbonate on muscle fatigue and the subsequent recovery process. Aging men frequently observe that their workouts feel more taxing than they previously did, even if their actual strength levels have not diminished dramatically. A significant contributing factor to this perceived increase in difficulty is the accumulation of lactic acid and a slower rate of its clearance from the muscles. Bicarbonate aids in neutralizing the excess hydrogen ions that are produced during strenuous exercise, a process that directly delays muscle fatigue and enhances endurance. Improved muscle performance, in turn, has a beneficial effect on overall circulation. When muscles contract efficiently, they function as dynamic pumps, assisting in the return of blood to the heart. This enhances venous return, reduces the tendency for blood to pool in the lower extremities, and provides vital support for overall cardiovascular health. Over time, this creates a positive feedback loop. Enhanced circulation supports greater physical activity, and increased physical activity, when managed appropriately, further contributes to improved circulation. Now, let's address the role of the kidneys, which are instrumental in the regulation of bicarbonate levels. As men advance in age, the efficiency of kidney function gradually declines. This does not necessarily imply the presence of overt kidney disease, but rather signifies that the body's capacity to excrete acids becomes less effective. When the kidneys are unable to eliminate acids from the bloodstream as efficiently, the body's bicarbonate levels tend to drop, and the pH of the blood may subtly shift towards a more acidic state. This seemingly minor alteration, accumulating over years and decades, can have widespread physiological consequences. Research has consistently demonstrated that maintaining adequate bicarbonate levels in older adults is associated with better preservation of muscle mass, improved bone health, and a reduction in chronic inflammation. Inflammation, it is worth noting, is a significant adversary to healthy blood flow. Chronic, low-grade inflammation can inflict damage upon blood vessels, lead to arterial stiffening, and impair the normal functioning of the endothelium. Bicarbonate, by stabilizing the body's internal environment, indirectly contributes to mitigating this inflammatory response. It is imperative that I emphasize a critical point here. I am not advocating for men to begin consuming excessive quantities of baking soda without proper medical guidance. Such an approach can be not only ineffective, but also potentially dangerous, particularly for individuals who have pre-existing conditions such as high blood pressure, kidney disease, or who are taking specific medications. What I am advocating for is a deeper understanding of bicarbonate's fundamental role. This comprehension should serve as a springboard for developing more intelligent nutritional and lifestyle strategies that actively support the body's innate buffering systems. One of the most effective and natural ways to support healthy bicarbonate levels is through dietary choices. Foods that are rich in potassium, magnesium, and calcium are instrumental in assisting the body to produce and maintain adequate bicarbonate. Fruits and vegetables, with a particular emphasis on leafy greens, are considered alkaline-forming foods that can help to reduce the overall acid load on the body. This does not imply a need to eliminate essential nutrients like protein or to cease engaging in physical activity. Rather, it highlights the importance of balance. A diet that is chronically high in acid-producing foods, coupled with insufficient buffering capacity, places an undue burden on the body, especially as it ages. Furthermore, adequate hydration plays a profoundly significant role. Dehydration can lead to a concentration of acids within the blood and diminishes the operational efficiency of the body's buffering systems. Consuming sufficient quantities of water is crucial for supporting optimal kidney function and facilitating efficient acid excretion, which in turn helps to preserve bicarbonate levels. It is a common and often unrecognized issue that many aging men are chronically underhydrated, sometimes even deliberately limiting fluid intake due to concerns about urinary frequency. This can inadvertently exacerbate existing circulation problems. Stress management is another non-negotiable factor. Chronic stress triggers hormonal responses that lead to increased acid production. Hormones like cortisol and adrenaline alter metabolic processes in ways that amplify the acid load. Practices such as deep breathing exercises, prioritizing quality sleep, and incorporating recovery strategies all have a tangible influence on the body's acid-base balance. Even something as seemingly simple as slow, diaphragmatic breathing can improve carbon dioxide regulation, a process that directly impacts bicarbonate buffering. Physical activity, when undertaken correctly and in a balanced manner, can actually enhance bicarbonate efficiency over time. Regular, moderate exercise stimulates mitochondrial function, improves the body's ability to handle acids, and strengthens the cardiovascular system. The key here is to avoid excessive overtraining without adequate recovery, as this can overwhelm the buffering systems and contribute to chronic fatigue. Now, let us address a question that frequently arises. Can direct bicarbonate supplementation indeed improve blood flow? The answer to this is not a simple yes or no, it is more nuanced. In controlled scientific settings, bicarbonate supplementation has demonstrated the capacity to enhance exercise performance, extend the time to fatigue, and support vascular function. However, it is crucial that such supplementation is approached with caution and within an appropriate context. The ultimate goal is not to artificially manipulate the body's pH, but rather to support its inherent ability to maintain a state of balance. For aging men, the most profound benefit lies in understanding the underlying physiological mechanisms and proactively addressing the root causes of declining buffering capacity. This translates to optimizing nutrition, ensuring adequate hydration, supporting kidney health, maintaining muscle mass, and cultivating cardiovascular fitness. When these fundamental systems are robustly supported, bicarbonate can then perform its intended function, creating an internal environment where blood vessels can operate at their peak efficiency. This leads us to a broader perspective. Blood flow is not a condition that can be rectified with a single pill or a solitary supplement. It is the dynamic outcome of countless intricate processes working in concert. Bicarbonate represents one vital piece of this complex puzzle, but it is undeniably a foundational one. When the delicate pH balance of the body is disturbed, every other system struggles to compensate effectively. I have personally witnessed men in their 60s and 70s experience dramatic improvements in their circulation, energy levels, and overall quality of life. This transformation has not been the result of chasing superficial quick fixes, but rather through a dedicated focus on addressing these underlying physiological systems. Enhanced blood flow translates directly into more productive workouts, sharper cognitive function, improved urinary health, and a greater sense of confidence and well-being. It means your body is better equipped to respond when you ask it to perform. Therefore, if you are an aging man, or if you are someone who cares deeply about one, I urge you to begin conceptualizing circulation in a new and more comprehensive way. It extends far beyond mere cholesterol numbers or blood pressure readings. It is about the intrinsic ability of your blood vessels to adapt and respond in real time. It is about whether your internal environment is conducive to vascular flexibility, efficient oxygen delivery, and effective signaling throughout the body. Bicarbonate quietly underpins all of these critical functions. It does not garner the attention it truly deserves, perhaps because it lacks the inherent flashiness of some other health trends. However, in the realm of medicine, the most powerful and impactful systems are often those that operate silently in the background, diligently maintaining balance, stability, and resilience. If you have found this explanation to be beneficial and insightful, I encourage you to remain engaged with this channel. We are committed to continuing to break down complex health topics in a manner that is not only understandable, but also empowering, enabling you to take greater control of your health journey as you age. And for those of you who have personally noticed changes in your energy levels, circulation, or overall performance, please understand that aging does not inherently equate to an unavoidable decline. It signifies that your body may benefit from more informed and intelligent support. This is Dr. Sarah, and I look forward to our next conversation.